My name is Dr. Barry from FMC Ovwian, and today's topic we'll be talking about high blood pressure. What is high blood pressure? It's a medical condition whereby your blood pressure reads 140/90 on two or more occasions. We call high blood pressure a silent killer. Reason being that most times people don't get to have symptoms until it has become complicated, issues with heart attack, issues like stroke. But there are times whereby you get to have early symptoms like headache, you can't sleep, recurrent difficulty to sleep. There's some of the early symptoms you can have when it comes to high blood pressure. So if you feel like you're having recurrent headache and you find it difficult to sleep, you're restless at night, most people would attribute it to malaria. And even after treating malaria, they still find out that they're still having the same symptoms. I would advise that you check your blood pressure, because when we discuss with patients, they're always like, I don't like coming to hospital. I prefer going to the pharmacy. I prefer going to a chemist. No. That's not the right thing to do. It's advised that at least a minimum of twice a year, we go for routine medical checks. All right. So what are the things that can actually cause high blood pressure? More like risk factors to high blood pressure. Number one, family history. If there's a family history of high blood pressure, the chances of having it increases. Number two, your lifestyle. What I mean by your lifestyle, something we call sedentary lifestyle. You are not active. You are always in the house. You don't go out. You don't stroll. You don't do daily activities that will give you strength and all of that. You're always seated at home. We call it sedentary lifestyle. Another thing that can happen is the abuse of alcohol. You know, some people, they even boast about their drinkage of alcohol, that I drink past my friend. They get to compete when it comes to alcohol. That can also be a risk factor for high blood pressure. Another thing is smoking cigarettes, all of that, as because the more you smoke cigarettes, there's a way it can affect your blood vessels. Your blood vessels becomes reduced in size, and the pressure to which the blood flows through the blood vessel becomes increased. Another thing can be obesity. People on the big side, the more of that can lead to high cholesterol. And when the cholesterol in your body is high, it can also lead to high blood pressure. All right, then another risk factor can be an intake of salt. Too much salt in your food can lead also to high blood pressure. So with this, I believe that if you find yourself in one or two of these conditions, I would advise that you take a chill pill, look back and examine your life to see how well you can improve your health. Because they would always say health is wealth. And if you really want to live long, I would advise you look into these things that I've mentioned so that your health will be on the better side. And I would also advise, as a doctor, please come for your routine medical check. And with this, I'm inviting you to Federal Medical Center Ovwian, whereby we'll check your blood pressure, we'll check your pulse, we'll do all sorts of tests for you to see that your health is fine. So with these few points of mine, I believe you've heard what I've said, and I believe you will take them into action. And as you do so, I promise you, your health will become better. Have a blessed day.